Welcome to our channel, the Fit Hub. We are telling about poliovirus. Poliovirus. The poliovirus, a member of the Picornaviridae family, is a highly contagious virus that mainly affects children under 5 years old. It causes poliomyelitis, a disease that can lead to paralysis and, in serious cases, death. What is polio? Poliomyelitis is a crippling and possibly deadly disease caused by poliovirus. It invades the nervous system and can cause permanent paralysis within hours. While many infections are asymptomatic or mild, severe cases can result in lifelong disability. Types of polio. 1. Non-paralytic polio. Flu-like symptoms such as fever, tiredness, sore throat, and headache. Symptoms last about 1 to 2 weeks without long-term affects. 2. Paralytic polio. Less common. Affects the spinal cord, spinal polio, head, bulbar polio, or both, bulbospinal polio. Symptoms include loss of reflexes, significant muscle weakness, and flaccid paralysis. 3. Post-polio syndrome. PPS. Affects polio patients years after recovery, causing muscle pain, weakness, and fatigue. Transmission. Fecal-oral route. The virus spreads through contaminated food, drinks, or surfaces. Respiratory droplets. Occasionally spreads via coughing or sneezing. Polio is highly contagious and can spread quickly in places with poor sanitation. Symptoms. Most people infected with poliovirus, 72%, do not show signs. For those who do, 1. Mild symptoms. Non-paralytic polio. Fever, fatigue, nausea or vomiting, stiffness in the neck and back 2. Severe symptoms. Paralytic polio. Sudden start of muscle weakness, loss of reflexes, difficulty breathing, if lung muscles are affected. Complications. Permanent paralysis. Most feared problem. Death. Occurs if numbness affects breathing muscles. Post-polio syndrome. Long-term effects decades after the initial attack. Vaccination. Polio has no cure, but it can be avoided through vaccination. 1. Oral polio vaccine, OPV. Live. Weakened virus taken directly. Provides community protection through virus shedding. 2. Inactivated polio vaccine, IPV. Given via shot. Safe for immunocompromised people. Global polio eradication. The Global Polio Eradication Initiative, GPEI, has greatly reduced cases worldwide since its launch in 1988. Polio remains common in a few countries, including Afghanistan and Pakistan. Vaccination campaigns aim to fully remove polio globally. Prevention. Tips. 1. Vaccination. Ensure children are fully vaccinated. 2. Good hygiene. Wash hands thoroughly, especially in places with poor sanitation. 3. Safe water. Avoid drinking or using dirty water. Current challenges. Vaccine hesitancy and lies. Conflict and political instability in polio-endemic areas. Emerging outbreaks of vaccine-derived poliovirus in under-vaccinated places. Would you like specific visuals, statistics, or a script for this topic?